Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 1,470 new cases of COVID-19. This brings our statewide total to 12,980 Pennsylvanians who have tested positive in 65 counties in the Commonwealth of Pennsylvania. Approximately 598 of our total cases are in healthcare workers. Approximately 518 of our total cases are in long-term care living facilities. Tragically, we now have 162 deaths among those who have tested positive for COVID-19. And to date, all of our deaths have been in adult patients. We have been working with our hospital partners to get the most accurate possible data of our healthcare system capacity. 2 weeks ago, I ordered our healthcare system to begin reporting data to us, actually 3 times a day, regarding their current available beds, ventilators, and the number of patients that they have hospitalized with COVID-19. As of noon today, across our healthcare system in Pennsylvania, approximately 51% of our hospital beds, 40% of our ICU beds, and nearly 70% of our ventilators are still available. As of noon today, hospitals are reporting that approximately 1,613 patients are currently hospitalized due to COVID-19. This is approximately 12% of our total case count. 533 of those patients that are hospitalized require the use of ventilators or breathing machines. As we continue to work with our healthcare providers to make sure that they have the personal protective equipment that they need to care for patients, and we will continue to work with them to make sure that they have all of the equipment that they need, the resources that they need to take care of patients. To date, we have distributed this equipment to hospitals, EMS, county health departments, county emergency management agencies, and long-term care living facilities. This includes the distribution of more than 1.5 million N95 masks, 106,000 gowns, 701,000 procedure hospital masks, 560,000 sets of gloves, 990 goggles, and 120,000 face shields distributed to healthcare systems, EMS agencies, long-term care living facilities, etc. And while we work to secure more equipment, our first responders need us to do our best, and that means please stay home. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing happy birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch your face, especially at touching surfaces. Clean surfaces frequently. And if you are going out for life-sustaining activities, please wear a mask if you're going to come in contact with others. Practicing these everyday prevention measures can help slow the spread of the dangerous virus, COVID-19. Please remember, if you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-8888. 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I would like to turn things over to Governor Wolf. Governor.
Thank you, Dr. Levine, and thank you all for joining me. As Dr. Levine just said, we're continuing to see a growth in the number of cases of COVID-19 in Pennsylvania. A surge is coming, and the when and how bad that surge is really depends on all of us, what we do. We need to keep doing the things that we know can save lives. For example, we need to continue social distancing. We need to do as much as we can to support our healthcare systems throughout the Commonwealth. We need protective equipment. We need ventilators. We need staff. We're also working to acquire as much equipment as possible, but we've had challenges in purchasing equipment because really there just isn't enough supply to meet the demand. And right now, every state, and many countries for that matter, are looking to build their supplies of personal protective equipment, of ventilators, and the things that they need and we need to fight this epidemic. While we continue to pursue purchasing this equipment through traditional means, we also need to look inwards to ourselves, to Pennsylvania. So on Saturday, here in Pennsylvania, we launched the Pennsylvania Manufacturing Call to Action Portal. And that's going to connect manufacturers in Pennsylvania together to form a supply chain of needed equipment. The creation of the portal will help mobilize manufacturers that are producing COVID-19 related products or supplies. But it's also going to allow us to identify companies that can pivot to produce those COVID-19 supplies. I'm not sure that any Pennsylvania company can produce the ventilators we need as rapidly as we need, but many can rapidly produce components of ventilators, like plastic piping. We have that capability within Pennsylvania, right here. As we work to protect public health and safety and create a robust supply chain, we know that there are manufacturers across the Commonwealth who are willing and able to help. The portal will bring these manufacturers together to work as a team to help us get the equipment we need. Today, I'm asking Pennsylvania's manufacturers, Pennsylvania's distributors, and other suppliers to visit the portal on the Department of Community and Economic Development's website, dced.pa.gov, to report their critical supply chain capabilities, what their needs are, what their workforce gaps are, or what they see as opportunities in this process. The portal was developed through a joint effort between Department of Community and Economic Development, the Pennsylvania Manufacturers Association, Pennsylvania Chemical Industry Council, the Ben Franklin Technology Partners, the Hospital and Health System Association of Pennsylvania, the Industrial Resource Center Network, the Life Sciences Pennsylvania Life Sciences Greenhouse, and the Pennsylvania Chamber of Business and Industry. Manufacturers, the point is, manufacturers in Pennsylvania can play an important role in preparing and protecting our Commonwealth. So as we prepare for the surge, we all need to continue to do our part. Stay in your home unless you absolutely, positively have to leave. And if you must leave, wear a mask. Wash your hands. Stay 6 feet away from others. We all have a part to play. Citizens have a part to play in stopping the spread every single day. Healthcare workers who treat patients, they have a part to play. And manufacturers who must help us get the equipment we need, they have a big part to play. We're all going to get through this crisis, but only if we work together. So thank you to everyone, every single Pennsylvanian, for your efforts. Let's keep it up. Let's keep protecting Pennsylvania. Thank you very much. Now I will turn it back to you for questions.
Thank you, Governor. Our first question is for Dr. Levine. From several outlets in the Lancaster market, WGAL and ABC 27, are asking about Lancaster County having much higher numbers than normal than surrounding areas. Could you possibly share as to why that might be?
Well, we are certainly seeing widespread community transmission of COVID-19 throughout Pennsylvania. And so it's not that surprising that the county of Lancaster, with its proximity, its close distance to the immediate caller counties of Philadelphia, would see high rates. And so we're tracking all of those county rates really, really carefully. We'll be working with our county municipal health department partners, as well as the hospitals and health systems, to make sure that we can take care of any potential surge of patients that may occur in Pennsylvania.
And then as a follow-up to that, Secretary, what is your reaction to the fewer number of cases being reported yesterday? Is this good news or too early to tell?
Both. It is good news. Whenever we have a plateauing or even a decrease in terms of the numbers of new cases, I consider that good news. However, it is way too early to tell whether we are seeing a true plateau in the numbers of new cases. So we watch these over 3 and then 7 day intervals, and we'll be watching the rates really carefully. We're analyzing the models and to see how they fit, and we're going to be tracking this very, very closely, especially over the next number of weeks.
Secretary, from ABC 27 and PBS 39, questions about the holidays coming up, Holy Week, Easter Sunday, and Passover. Can families get together in one home for those meals?
We really recommend that people stay at home. And I know this is very challenging over this holiday season with Passover coming and then Easter and other holidays. And families are used to gathering together. Communities, congregations, synagogues are used to coming together. But at this time, what we really need to ask people to do is stay home. So if you would usually have your extended family over for a Seder starting on Wednesday and then Thursday night, please don't. Maybe do it virtually. I think that would be a great idea, to have a virtual Seder. And so each family that might have usually come together, or each part of an extended family, do it all virtually and celebrate the holidays, but do it in a safe way. I know the governor has spoken about this to religious leaders throughout the state and talked about it last week. It is so important at this critical time that people stay home.
WNEP, some county leaders are wondering if the state could share information on cases by municipality with them so that they could direct their emergency response better and also know about potential hot zones. Can you share some information on that?
Sure. So we've heard a lot of requests from county officials and EMS officials and the Pennsylvania State Police in terms of how we share our data. So we are actively in discussions about that, and we're hoping to have a solution that balances all of the needs this week.
Governor, we have a couple of questions for you from ABC 27. Why have lottery sales not been suspended? Players have to leave home to buy tickets.
Lottery tickets are actually sold in convenience stores and food stores, which are open. Also, the funds from the lottery go to support essential services for senior citizens, and so both of those reasons, the lottery has remained open.
And then also they'd like to know, why are big box stores like Home Depot and Lowe's allowed to remain open when they could pose a health threat to shoppers? Why not operate like a restaurant?
We look at Home Depot and Lowe's more as we do a pharmacy or a food store. They sell cleaning supplies that are necessary to take us through this crisis, and they also sell products, supplies to maintain homes, which is absolutely essential through this process.
Governor, from Penn Live, we're hearing concerns from people who work at life-sustaining businesses and offices that say until you make wearing of masks mandatory, their employers are not requiring it out of concern that it creates the impression that someone there has the virus. Would you consider ordering Pennsylvanians to wear masks, and what do you advise people in those situations to do? Yeah,
I'm trying to get, as I said, as of today, I'm urging all Pennsylvanians to wear masks. And I think this again gets back to the central point. We all have a role to play. And we shouldn't be forced to do this, because this is what we need to do to save lives, in some cases even our own life. So we've got to practice the proper hygiene, make sure that places are clean. I've sent out guidance to companies, especially in businesses like distribution companies with buildings that are bigger than 50,000 square feet, and I'll continue to do that. But essentially, as Dr. Levine said, we have had a couple days now where we have fewer. The rate of increase seems to have reached a plateau. It's too early to tell. But even if that were true, we're still growing at an alarming rate every single day. More and more people are getting sick, and more people are dying. And the only way we stop that and keep that surge from getting out of hand beyond the capacity of our healthcare system is for all of us to do our part. And part of that is making sure that if we are working in an essential service, that the employer and the employees all work together to make sure that they're safe.
Governor, we have a couple of questions regarding Northeast Pennsylvania from WNEP and WBRE. We know that Luzerne County has 849 cases of coronavirus. The high number is a particular concern. Over the weekend, local official in that area instituted curfews. Has there been any consideration to the request by officials in Luzerne for state help in the Hazleton area, including the National Guard?
We're always talking to municipalities and counties about what we can do, and sometimes, after considering it, we say we're not going to do that. At this point, I have no intention of sending the National Guard to Luzerne County.
And then, Secretary Levine, as a follow-up to that question, from the morning call, obviously those four counties, Monroe, Lehigh, Luzerne, and Northampton, share borders and form a rough semicircle. Why is this string of counties hardest hit? Is it ties to New York and New Jersey, or perhaps the number of high-density warehouses in the region?
So we're not exactly sure why the Northeast has become an area of concern. As you've pointed out, we have seen an increase in the number of cases in the Northeast of Pennsylvania. So we'll be looking at that data closely, considering all the different possibilities of why there might be increases there. Of course, we have widespread community transmission, or sometimes called community spread, everywhere in Pennsylvania, but that does seem to be a significant area of concern, and we'll be looking at that, working with local authorities and local health systems in that area.
And then, Secretary, from WGAL, what kind of statistics can you share with COVID patients, on the COVID patients so far? Do you have any statistics on recovered patients? Can you break it down by age, gender, underlying health conditions?
So we do have age statistics, and those are available on our website. And there are many different health conditions that can predispose someone towards having COVID-19 and a very severe case of COVID-19. So that would include, as was discussed last week, diabetes, also heart disease, hypertension, lung conditions such as chronic obstructive pulmonary disease, chronic kidney disease, etc. So we're looking at all of that data and the data that we get from our hospitals and health systems for hospitalized patients. We are not able to track who has recovered from the illness. We have no way of tracking when someone, for instance, had a mild illness, they were at home as instructed, they were isolated, they recovered, they followed the CDC guidance, which is available on our website, and now they're fine. We have no way of tracking that. We are working to get data on hospital patients that are discharged. So we will hopefully be able to have that data later this week. But in terms of patients who've been at home and recovered, after the pandemic is over, we'll be doing certainly a retrospective review of all of that data, but I don't have it now.
Secretary, from the Associated Press, can you give us an update on how many ventilators are available for use in Pennsylvania's hospitals and how many more you're trying to get?
So I had spoken before about the percentage of ventilators that are in use. We actually have over 5,000 ventilators in hospitals in Pennsylvania now. As we've been having more hospitals collect data and transmit it to our system. We have discovered that there are actually more ventilators than we had initially anticipated, so that's a really good thing. We do have a stockpile of ventilators for the Department of Health, and we have purchased ventilators that should be arriving later this month. And so we're always looking to make sure that we will have enough ventilators to deal with the surge, and specifically in different areas. And so all of that is part of our calculations and our efforts now.
Secretary, from WTAE, we continue to hear about new cases in nursing homes throughout western Pennsylvania. Is the state seeing a rise in confirmed cases in these facilities? And does the virus appear to be spreading in these facilities more rapidly than other locations?
Well, certainly, nursing homes and other long-term care living facilities are some of our most vulnerable areas. First, individuals there, of course, are seniors and thus more at risk for infection and complications from the virus. And then they also have more other comorbid conditions, other chronic medical conditions that would make them more vulnerable as well. And so our team is working really, really closely with nursing homes and other long-term care living facilities throughout the state. We're collaborating with the Department of Human Services as well as the Department of Aging. We have just finished a contract, and I mentioned this before, with a provider to provide virtual consultative services to long-term care living facilities and help with their infection control plans. They can even do sort of a virtual walk around the facility to make sure that that everything is being done to protect the staff as well as the patients in those facilities.
Governor, the next question is for you. From the Scranton Times, how is the process of coming up with the 2021 budget coming along? You still have 3 months, but how is the virus complicating the process?
Well, it's complicating the process in that the estimates for the current year, which we were doing very well with up through the end of February, have all fallen to pieces. So we're looking at a fourth quarter, that's the April, May, and June months, that will not be anywhere close to what we anticipated. We're doing everything we can to reduce our operating expenses. We've put, where possible, money into budgetary reserves, and we're hoping that the federal stimulus package will help the state moving forward. But there's no question that in the current budget that we have some work to do. Looking ahead to next year's budget, we're working with the legislature on exactly how we want to work together on next year's budget with these greatly altered conditions.
Governor, from WNEP, we've heard from several viewers who have had difficulty contacting the unemployment office to sign up for benefits. What is being done to address the backlog and handle the increased number of applicants?
Yeah, first of all, we're all sorry that the backlogs happen. There's been an unprecedented increase in the number of initial unemployment claims. So what we're doing is we're investing heavily in new technology. We have some new technology that just came up this afternoon, I think, as we're speaking. We're also adding people. So we're bringing people from other agencies to work in the call center. So we're doing things we can to make sure that we're as responsive as we can possibly be for people who are applying for this absolutely essential service.
And then, Governor, from the Bucks County News, do you think the stay-at-home order will go beyond April 30th?
At this point, it's too early to tell, but it certainly, to this point, seems to be making a difference. We talk about a 15-day lag between the time of a case appears and the time we actually see some benefits, but we are starting to see that the early exponential increase in cases has given way to a much flatter, and so that the surge may not be as great as we once anticipated. That's our fervent hope. And the only way we can get to that point, again, where we are not outstripping the capacity of our healthcare system, is to stay at home. So if an extension is necessary, we'll do that because it's going to save lives. So that's at this point, I'm not moving it beyond April 30th, but that may happen.
Secretary, the next question is for you. From the Press and Journal, Over the weekend, White House Correspondents' Response Coordinator Deborah Birx stated that Americans should try to avoid stores and pharmacies in the coming weeks. What advice do you give Pennsylvanians?
I think it's really important over the next number of weeks, critically important for people to stay home as much as possible. As the governor has stated, that if there's an urgent need to get a medicine or to get food, then certainly people will need to do that. If you do that, then please wear a mask. Remember, your mask protects me and my mask protects you. But if it is all possible to avoid going out in public, now is the time to stay home. It's very important that people in Pennsylvania not become complacent, that they don't have a false sense of security. This is a critical time in Pennsylvania in terms of the pandemic COVID-19. Please stay home.
And then as a follow-up to that, the Washington Times is asking that Dr. Birx also mentioned Pennsylvania as a possible next hot spot as New York and New Jersey and Detroit see their peaks. What does she mean? Is there something Pennsylvania is seeing, a coming surge or peak?
Well, we're displaying and putting out all of our data. And so you can see these increases that we have had. It's good news that the last couple of days have not seen as much of an increase, but we're still seeing a significant number of new cases every day. We are still seeing, tragically, more people die every day. And we're sitting right next to New York and New Jersey. So I think that that's what she means. There's nothing else that she'd be referring to. So I think that should spur everyone to take this opportunity to stay home and protect themselves, protect their family, their neighbors, their community, and our Commonwealth. The best thing that people can do right now is to stay at home.
Secretary, from WTAE, can you please restate the best practices for going outside for exercise? Can people walk their dogs? Can they take their children on hiking trails? And should they wear masks on walks?
So if you're going to go outside and do exercise, then you need to do that in a solitary way. So I guess if a family and their children were out taking a walk and it's just that family group that would be at home together anyway, then that would be fine. It is okay to take your dog for a walk or to go for a run or to go for a bike ride, but not in public areas with other people. So if everyone goes to the same park and they're not able to practice social distancing and they're closely packed together, then that would not be safe. It would only be safe for people to go out and exercise if it's solitary, or I guess one small family unit that is together anyway. If you are truly isolated and it's just you don't have to wear a mask, but it might be good to have the mask with you in case you do encounter some other people. But the only safe way to go out at this time is to do so in isolation, not with large group of people. That would be dangerous.
Secretary, from the Tribune Review, researchers at UPMC and other healthcare systems across the country and globe are working on antibody tests that could tell us more about immunity to COVID-19. Countries like Germany are considering using such tests to issue immunity certificates and list social distancing measures. Would Pennsylvania health officials consider doing this, and what are the concerns, drawbacks, or questions that need to be answered first?
Well, so the first antibody test in the United States was authorized by the FDA in the middle of last week. So it's been a number of days, and it's actually currently not readily available. So we will see the utility of those antibody tests. I can certainly see their usefulness as time goes on to certify that and verify that someone is immune. We have no plans right now to offer anything like immunity certificates. There's much more to learn about COVID-19 and what exactly these tests mean. They are not a test of infection, so they're not used to see if someone is currently infected with and contagious with COVID-19. Those are the viral detection tests that are being done now. But in the future, we do anticipate that these antibody tests will be useful, and so we'll be working on how to implement them when they become readily available.
And Governor, our last question is for you. From the Altoona Mirror, any idea how people have been responding to your mask recommendations?
Well, it's too early to tell. This is the first day. As I drove up here from York County, I saw a lot of people wearing masks. Again, this is the kind of thing that's very different. It's like it was when we started wearing seatbelts in cars. It'll take some time, but the idea is that this is for our own protection. This is for the protection, actually masks, protecting people we love, people we're close to. So I think people will pick it up. Again, this is the first day. It's a little early to tell, but Pennsylvanians have been really great about doing the things we need to do to keep the surge from getting out of hand. And if we continue to do this, then that surge is not going to be bigger, greater than the capacity of our healthcare system. That's the goal. It's the goal with masks. It's the goal with social distancing. It's the goal with everything we do, especially, as the Secretary said, when it comes to staying home.
Thank you so much, Governor. That concludes our briefing for today. We will bring you our next briefing tomorrow.